good evening, everyone. How is everyone doing today? We're very pleased to be welcoming you to our session on menstruation and WASH, learning from global emergencies in the workplace context. The co-conveners for this side event session are Columbia University, the International Rescue Committee, the USAID WASH Pals Project, and WaterAid. Next slide, please. I'm pleased to welcome you as Director of Research at Iris Group and as a representative of the USAID WASH Pals Project. Pass it over to Marnie now.
I was muted. Sorry about that. Also delighted to welcome you. Marnie Semmer is the Associate Professor at Columbia University at the Millman School of Public Health. And it's really a treat to be here with all of you today and with our partners at Iris Group.
Great. Just going to walk through the session agenda for today. So we're going to start in a main plenary session in which we're going to have two presentations. One from the Columbia University IRC team, focusing on MHM and emergencies and sharing some new resources related to menstrual disposal, waste management, and laundering in emergencies. And then we'll proceed into a presentation on what works to advance menstrual health and hygiene in the workplace. After this session, we'll divide up into breakout groups where folks can choose whether they'd like to focus on MHM and emergencies or MHM in the workplace. And after that, we'll come back together to do just a wrap up and discussion of key learnings. I'd like to remind everybody that if you have questions, to please ask them through the entire session. As you might know by now, the disabled. So you'll have to go into the Pathable platform and do that. And I'd also encourage you to just introduce yourselves if you haven't already, to share what organization you work with, and we'll compile the questions and tackle them towards the end of the breakout sessions. So welcome again, and over to Marnie.
Terrific. Yeah, just to further endorse that suggestion from Aditi, seeing who's online, since we can't be together in person, would be really wonderful. So if you could, in the chat box, take a moment, your name, your organization, your country, just so we can see where you're dialing in from today. I think one of the nice things about the UNC side sessions is they're an opportunity for networking along with learning. So hopefully there will be some networking and connecting that happens even in this online approach, which the conference is to be commended for. So just really a minute, because the most interesting thing about today will be the presentations and hearing from all of you during the breakout, is we wanted to just talk a little bit about menstruation as sort of the how it flows through these two presentations. And just in terms of sort of historically, UNC has always been really, I think, one of the leading conferences that has included attention to menstruation much earlier than other organizations out there and other conferences. So they're really to be commended. And for many years, what that inclusion of MHH was WASH in schools. And while WASH in schools remains critical and has not gone anywhere in terms of its importance, I think what's very exciting about today's session is, and also the other sessions at the conference, I know there were some earlier this week, is the inclusion of both this sort of one very overlooked area, which is MHH in the workplace. And so it's very exciting that we'll hear about that today. And then a slightly less overlooked in the last couple of years, thanks to the British government and the US government funding some work around MHH, addressing it in emergency humanitarian context. So what we thought would be useful, just as sort of a framing slide, is what the key components to MHH are that we're talking about. I'm not going to read through this, but I think what will wind its way through both presentations that you're about to hear and then subsequently come up in the breakouts is these 4 key aspects, which are really critical to addressing the needs of all people with periods, whether they be at work, at home, in a refugee camp, wherever else it may be. So on to the more exciting part of today. I'd like to introduce Maggie Schmidt, who is the Associate Director of the GATE program at Columbia University. Maggie worked on the development of the MHM and Emergencies toolkit, which I think she will mention, and also, and more recently on OFDA supported compendium that we'll address as that title of the presentation says. And then our fantastic colleague at the International Rescue Committee, David Clatworthy, who has been a joy to work with all these years on this topic of MHM and emergencies. So over to you, Maggie, and then David.
Hello, everyone. I'm Maggie Schmidt, and as Marnie said, I work with Columbia University for the past 10 plus years. And today I'm going to be walking you through a brand new resource we've developed in collaboration with the IRC and through support from USAID's Office for Foreign Disaster Assistance. So as Marnie just alluded to in her introduction, I do want to mention that when we talk about MHM response in emergencies or development context, we are generally thinking about these 3 main components, which includes MHM materials and supplies, supportive wash facilities such as toilets, bathing spaces, and laundering areas, and lastly, MHM information, including menstrual health and hygiene education. So when we consider these 3 components in refugee or displacement context, the picture is a bit more complicated. Over the past 5 years researching on this topic, we've gotten a much better idea about how complicated addressing these 3 components can be during an emergency. And although we've long known that space and privacy are critical issues for many girls and women in displacement, there's been growing attention towards other issues such as disposal, which means how can girls and women dispose of used menstrual pads or cloths, which can be an incredibly daunting task for many girls and women, given pervasive cultural taboos surrounding menstrual waste found in many regions of the world. And in response, some girls and women may adopt coping mechanisms, such as getting up really early in the morning to go discreetly bury this waste outside. The provision of reusable menstrual products has also become increasingly popular in both development and emergency contexts. And reusable products create unique issues in terms of, especially for displaced girls and women, in terms of how they're able to discreetly wash, dry, and store these items. All of these issues have come up frequently within our research and have kind of helped shape the focus of this project. So in 2017, our MHM and Emergencies team at Columbia and IRC wrapped up developing the MHM and Emergencies Toolkit, which was an introductory resource about integrating MHM into humanitarian response. And during the toolkit development process, we identified several important gaps in knowledge and practice. And this included a lack of culturally sensitive menstrual disposal options, a lack of attention to strategies for dealing with menstrual waste, and lastly, a lack of understanding on the types of supplies and infrastructure needed to better support girls and women with the washing and drying requirements for reusable materials. And so all of this kind of sets the stage for the compendium project we're going to introduce here today. So in 2018, Columbia and IRC embarked on a new MHM and Emergencies project, which really aimed to kind of tackle some of these gaps in practice that we had identified. And to accomplish this, we conducted a series of site visits to ongoing emergencies to speak with girls and women and implementation staff. We did global key informant interviews, we did outreach across the humanitarian community, and we did a desk review. And although we'd love to share findings from these assessments, we do have pretty limited time today, so we're going to just focus on the resource itself. We do have forthcoming publications under review that will hopefully share some more information about our findings. Okay, so this is the cover of the compendium, and you can download this resource in the files section of our session here today. There are 6 chapters for the compendium, which focus on the key areas of disposal, waste management, and laundering. But we also provide attention to female-friendly toilets, given their overlap with menstrual disposal, and the role of consultation and IEC materials in supporting the design, usage, and maintenance of any MHM supportive facilities. So before digging into various examples that we found during our review, I did want to mention that in addition to new facilities, we were excited to learn about a range of innovative consultation methods targeting girls and women for WASH facility design. We found several examples of organizations seeking to engage girls and women in the design phase. And notably, many of these approaches sought to help girls and women visualize WASH facilities prior to construction. So this includes through drawing and both the creation of digital and physical models. And so now moving into menstrual disposal, which was one of our main focus areas. This image here is an infographic, which can be found in the compendium and depicts the 4 key elements when designing a menstrual disposal strategy. And this includes communication with users, discrete design so that women and girls can utilize this option privately and with ease, considerations for the maintenance of the strategy over time, and lastly, the method for waste management. And by waste management, we mean what type of final disposal method will be used to treat this waste, such as burning. So we did find several organizations, both in emergency and development contexts, that were trying to address this issue. There are pretty basic designs that include simple bins directly inside toilet stalls, accompanied by posters and stickers trying to guide users. But some organizations were taking a bit of a different approach, and this included actually integrating disposal into the design of female toilets. After community consultation, the Bangladesh Red Crescent Society, with support from the Danish Red Cross, for example, actually embedded disposal pipes, you'll see a small little pipe in the right-hand corner, into female toilets, which offered women a discreet and convenient way to drop this waste. And the tubes led to external containers, which would store the waste until it was full and ready to be burned. A similar model was found at an MSF hospital in Cox's Bazar, but instead the pipes actually led to a color-coded external bucket system, which was located behind the bathroom facility. And this bucket was then routinely emptied for incineration with other hospital waste. This model has since been piloted in the DRC as well. And now moving into a few examples for waste management. So although we found much less innovation being done on the topic of waste management, we did identify some models being tested in Myanmar and Sri Lanka. And this included the use of incinerators that were placed directly outside of female toilets for the incineration of disposable pads. And in the case of Myanmar, this was a very iterative design process where several models of incinerators had been tested and tweaked over time. And now just a couple quick insights on the laundering of reusable menstrual materials. So this is another infographic about why laundering is so important to consider when providing reusable materials. Girls and women need to be able to easily wash, dry, and safely store reusable materials if they're going to be able to use them over and over again as intended. And this has implications on the types of supplies they need, including the frequency and quantity for the provision of these supplies, facility design, and informational needs. So here's an example from Bangladesh that we found pretty interesting in that it's a combination laundry facility constructed inside of an existing women's protection space. This dual purpose space enabled girls and women to do their laundry, including washing menstrual materials, while also accessing other services offered at the protection space and benefiting from collective childcare support. And in terms of the design of the facility, please note that the laundry stalls were separated by shower curtains, which allowed women to pull the curtains when they wanted additional privacy if they were washing more sensitive items like underwear or menstrual pads, but then to open it up if they wanted to socialize with others while doing other laundry. And so now actually I'm going to hand this off to my colleague David from the IRC, who's going to speak a bit about a new assessment tool that we also developed.
Great, thank you, Maggie. Excuse me. As Maggie says, I'm going to be talking about a separate output from the same research project, and this is an assessment tool for assessing MHM, the component of humanitarian response. Can we go to the next slide, please? We've seen over the last few years much more attention to MHM in humanitarian programming across the world, and that's been a fantastic step forward. On the other hand, we do still see that programming can be quite piecemeal, with different organizations acting somewhat independently, and often we see quite large gaps left as a result. So really, to try and help to move the craft forward, we developed an assessment tool designed to be deployed as early as possible in a humanitarian response. We know that practically it's likely that people will only start assessing MHM once a basic WASH response is underway. So we took cognizance of that. But the concept is that this should be used as early as possible. Just as background, over the course of this research project and our previous MHM and Emergencies project, we had the opportunity to visit 6 ongoing humanitarian contexts. Although our purpose in visiting those was not to assess the humanitarian response around MHM, the activities that we did there of interviewing humanitarian actors, visiting sites, leading FGDs and trainings and so on, did allow us to, give us good insights into how effective response was. And so we drew heavily on that in developing this rapid assessment tool, calibrating the findings across those research visits, and then getting peer review by subject experts to try and improve the tool further. Can we go to the next slide, please? As Maggie discussed earlier, really the 3 basic components of response are materials and supplies, facilities, and information. And so the MRAT rapid assessment tool is focused around, is built around those 3 components. However, what we have found in our work is that there's sort of a root and branch situation. Obviously, what we're aiming to achieve is that women and girls are able to access these 3 components easily and are satisfied with that access. In order to achieve that, though, if we think about that as the branches, we need a solid root system, and that root system really is the structure of the humanitarian response. It needs to be well organized and well coordinated in order to achieve that success. So therefore, the rapid assessment tool that we developed actually has 6 elements focused on these 3 components, but then each one subdivided into the humanitarian system's capacity to deliver and women and girls' ability to access these components. Next slide, please. The tool itself is in an Excel format. I appreciate this is too small for you to read on screen, but it's just to sort of give you a sense of the format. It's based on a series of questions and answers, and the answers, suggested answers are provided from a drop-down menu with ranking from 1 to 5 as well. The assessor doesn't have to use that. They can write in their own answer and their own ranking if they prefer. And there's sort of ample opportunity to add in text to describe why those answers were selected and to support that with additional information. In order to fill out this form, though, the assessor needs to carry out, or the assessment team needs to carry out a series of field activities such as focus group discussions, interviews, etc. These are all laid out in the assessment guideline. And so the idea is that really only after completing those field activities will they really be able to come back to this form, which should then be easy to fill out. Next slide, please. And then as this form is filled out, the results are automatically summarized onto a results tab. And again, you can see the 6 components or the 6 categories with supplies, information, and facilities ranked as arranged vertically, and then women and girls access on the left and the functionality of the humanitarian system on the right. We went for the sort of Yelp review style of 5-star rating, 1 to 5 stars, because we feel that that's an increasingly well understood ranking system in the world today. But then the subcategories beneath also give more detail about how that score is arrived at and highlight perhaps specific strengths and weaknesses within these categories. I should say that this is looks very numeric for what is really a qualitative methodology. It's not intended to be for comparing across humanitarian contexts because each humanitarian context is very different. But it is useful for identifying individual weaknesses and hopefully also for tracking improvement over time if this is repeated again. Can we go to the next slide? I would say that this rapid assessment tool was launched in the middle of the COVID lockdown, so we haven't really had as much opportunity as we would have liked internally to carry out further testing of the MRAT in humanitarian settings, but we do really hope that other organizations will use it. And if you do, please get back to us and give us criticisms, comments, or just tell us how the process went. Wrapping up the session from Maggie and myself, I do want to add that we really appreciate all the inputs from all the other organizations that collaborated with us in developing the compendium and resources. It was ultimately co-published by 16 leading WASH organizations, as well as IRC in Colombia, and a shout out to our donors, OFDA, who also were really involved and engaged throughout the process. So yeah, thank you. I'm going to hand over to Haraj Asafa from Enterprise Partners, who will be talking about menstrual health in the workplace. Thank you.
Just a moment as we sort through some technical difficulties, you all.
Sorry, I'm having a bit of a connection problem. So I'm Harag Asafa from Enterprise Partners, here to talk to you about our experience on MHM at the workplace, particularly at industrial park setting. So next, you can go ahead and start. Okay, so just to give you a little background about EP, Enterprise Partners is a UK aid-funded program that was established in 2013 to facilitate market development in order to create jobs and raise incomes for Ethiopians, for especially women living in poverty. So the sectors that we work in are textile and garment, leather products, horticulture, and industrial zone development. So under the textile and garment sector, the labor market subsector lies, and that's where we have most of our flagship interventions, particularly the industrial park labor sourcing, training, and employment program we have in Awasa Industrial Park, which is found at the southern part of the country. It was a system designed to systematize the labor supply of workers into the IPs from different catchment areas. So once we were able to create the system and brought the workers into the factory, we also were engaged in more interventions to help create decent jobs and increase retention of the workers, such as creating a standardized law and labor practices in the industrial park. Her project, which I'll be discussing later on, which we've helped launch the program at the industrial park. And also we've supported workers by developing a savings schemes for workers and also making sure that the labor force at the industrial park is disability inclusive. So these are some of the areas that we've engaged in. We needed BSR, her project, because IPs did not have support services for women and there were no trainings on women and health. Women There were no trainings for women on health and gender equality. So as you probably all heard or know, BSR, her project is a program that focuses on women's empowerment in the workplace through their training program on health and gender equality. So we thought it was important to launch her project, and it was launched in 2019 in 11 factories at the Awasa Industrial Park. And after the launch of the program, BSR had to do a baseline assessment in all these 11 factories to understand and to capture the knowledge, the behavior and access that women have on issues such as personal hygiene, menstrual hygiene, maternal health, nutrition, communication, gender-based violence, and other similar topics. And next slide, please. And it was because of that baseline assessment findings that we sought to deep dive into MHM, because the findings were quite interesting. It showed us that women workers missed work days due to MHM related issues. As you can see here, 6% missed 1 day of work at least in the month, in the past month. 4 missed 2 days, and 4% missed 2 days of work, whereas 3% missed more than 3 days a month due to MHM related issue. So we thought it was important to deep dive into the MHM. So BSR did an additional assessment, of course, through the support of enterprise partners, to understand more about the obstacles that women workers were going through. So BSR had to interview workers, job seekers, HR personnel to understand these obstacles in a holistic way. So the findings show that 31% of the workers reported leaving work due to the lack of access to menstrual products or pain relievers at the workplace. And we also found that 93% of the interviewed used disposable products as their main product. But it's important to note that in the qualitative findings, we've seen most of the workers use homemade clothes at home, whereas they use disposable pads as they go to work. So because they could not afford using disposable products throughout their menstrual period. And it was also interesting to learn that 25% of those who use these reusable products did not have a dedicated cloth for their period. So they would use any type of cloth that they find available. The other interesting finding was that there was no reusable products were not available in the market. So these women were forced to make them in their homes. This is the case because most of the reusable products being produced in Ethiopia are usually distributed or supplied to NGOs that would distribute them to, schoolgirls or probably girls in refugees, and whoever could not afford menstrual products. So they were not out there in the market available to be purchased. That was one of the findings. Next slide. So we also had to do a trial survey together with this baseline assessment, because we wanted to see if workers were also interested to try out a reusable product, an industrially made reusable product, because it's more affordable as they can use it for a longer period of time. So we used 2 locally produced products that are locally made. One was Mariod and the other is Mariam Saba. Mariam Saba is actually the product by Freweni. Maybe most of you know her, the lady that won the CNN Heroes of 2019. So we used her product as one for the trial. And the findings were also very, very interesting, because workers were very happy with the products, both of the products. They were comfortable to use it, and they said that they were equally satisfied with the products as the disposable ones. They even were happy to use them or even confident to use them at the workplace. unlike the homemade clothes that they use, because they never had that confidence to wear that and go to the workplace. So this was very interesting to see. And they have also said they have the needed resources to wash and dry their reusable products, regardless of the fact that they live in groups and they live in a rented compound. So it was also interesting to see that they had all the resources they need. Well, next slide, please. So as you can see here, this is the level of satisfaction that the workers had on, maybe you're sharing your screen until then. So the figures show that 56% were satisfied with the product, 39% were very satisfied with the product, whereas 5% were not satisfied with the product. So this shows that most of the women, majority of them were satisfied, equally satisfied as the disposable pads. So after the completion of this assessment, after the report was compiled, we shared the findings with the 2 manufacturers that produced the reusable products. And they were very thrilled to hear that their products had good feedbacks, and they have also shown interest to supply to the industrial park workers. So we're in discussion on how to avail these products to the industrial park workers. And it's very interesting for us as EP, because it sets a good precedence for other industrial parks, that are coming into operation, and they would also use this opportunity. Next slide, please. So let me finish off by raising few points as key takeaways for MHM in the workplace, and particularly in Ethiopia. So most women and girls in Ethiopia lack access to affordable and preferred products. They also lack private and safe wash facilities and education about menstruation. And this has led them to shame, fear, limited mobility, and discomfort during their menstruation. So, and obviously our practical experience from the industrial park, our engagement with them has shown us that women are challenged and they actually miss working days due to MHM related issues. And this has economic empowerment implication for these workers. So on the other hand, the private sector has also been absent in playing that role of creating access to menstrual products for girls and women. As these businesses usually concentrate in the cities and the big towns and do not stretch out to the rural areas and create the demand for the use of the product. Because our research has shown us that these girls actually said they can afford to buy these products if it was available in the market. The same goes of course, for the disposable, not reaching as many as it should. So I would like to end my presentation by emphasizing that MHM in the workplace is understudied. It is definitely understudied. Many of the research and interventions I can speak of for Ethiopia's case focus mainly on availing wash facilities and toolkits to school, creating access to products, researching policy advocacy, and changing social norms and taboos in the communities about periods. But it doesn't, there are no research or interventions related to the workplace. I'm not saying these are not important topics or important areas to cover, but the workplace has been left out. And our research or engagement has shown us that it's very, very relevant and important to discuss and to engage in. So there's clearly a gap in there. So I'm finished with my presentation. If you're interested in learning more about MHM at the workplace, one of the breakout group led by the WaterAid and IRIS group will explore that further. Thank you for listening.
Great. Thank you so much, Harg, for that wonderful presentation. We've now concluded the main session for now, and I'd encourage everyone to exit this Zoom room, go back into the Pathable platform, the website that you entered this room through, and click on the breakout room of your interest, and then you'll be able to join a separate Zoom room for that meeting. At the end, we'll come back into this main session to just wrap up. So hope to see you all very soon. Thank you.
So welcome to the wrap up. I think, Aditi, we should get going. Yeah, is that?
Yeah, that sounds good. Our session just ran over by a few minutes, so folks are just leaving and joining now.
Okay.
Just turn on my video.
Great.
Folks are coming back, which is great.
Yeah.
Marnie, just a reminder that we're going to get totally cut off in about 7 minutes. So.
Oh, okay, so maybe we should just get started. Do you want to go
Perfect.
first?
Why don't you all go first? Because I'm not sure Whitney's on as yet. She's going to do the wrap up for our.
Okay.
And one thing, if you are a host, please rename yourself so that your name does not say host 500. Thank you.
Okay. So noting we're going to vanish shortly. I'll just dive into, it was very interesting to hear people's thoughts. We had some questions we posed during the breakout. For those of you who were not with us, there's a lot left to be done in this space, but just to highlight some of the things that came up, which I think are really quite relevant to all of us working in this space. So one were, and I think this is something our own team has felt strongly about for a while, which is why we've been grateful for funding to do some of this work, is that two things that really need to happen to see people address disposal, laundering, and waste management better, be it emergency or development context, is one, awareness that this needs to be addressed, and how to address it and ask about it a bit more comfortably. And two, to see examples. I think we feel this quite strongly, that the more examples people see, the more likely they are to try something, to be willing to try something, to innovate a little. And by innovate, I don't mean fancy. I just mean they add a chute to the back of a communal facility. They add handles where there weren't handles to help pregnant women get up and down, or the elderly, to add locks and lighting. And so examples are a number one thing, and that in fact, because the way we're framing these are modifications, these are not whole new designs of facilities, and so therefore finance should not be really the limiting factor. So that was a key thing that came up. Another point that was made was also around when something happens like a cyclone or a natural disaster and wipes out everybody's toilets and latrines, and maybe that's where they've been disposing of their used products. You need to have an immediate solution as you rebuild about what kinds of products they can use in the interim. For example, if they use disposable, they may need to use reusable for a while if there's adequate water, so they can manage in the interim until they have some other kind of means to dispose. So, but also the key point being understanding the local practices of the population you're serving, which may need to be modified, as we saw in some camps over the last number of years, that if they're in a geographic context with a different water table, what they did before may not work where they are now. But it's essential to know what they were doing, because people will keep trying to do what they were doing if they can. And if that's not going to work in the new context, then there needs to be really careful assessment, and also sort of sharing and of guidance on and making it preferable. A second thing that came up that was a very good question was why the language still is not as inclusive as it could be. The guidance document focuses on girls and women, and so we had a sort of a good discussion around how much we wrangled with that question, and some of the reasons we thought for now, given the emergency response settings as they are, girls and women, just getting toilets for girls and women is still a huge issue, and that it may be a bit more tricky to add to, not only to expand that approach, but also it may create vulnerabilities to certain populations if there isn't cultural acceptance of sort of gender nonconforming and trans folks. So absolutely amazing question. We do need to be more inclusive going forward. And I think with the language that you use, you bring along the response. And so great question. And then a third point, which was really good, was countries that may have national strategies on MHH and may not be learning from the innovation happening in refugee camps or displacement camps that are also in that country. And so trying to find ways to bridge the divide between what's happening in the emergencies context with the larger national response. And some of what we saw in Cox's Bazar, that there actually was innovation happening in facilities, health facilities, serving both host communities and the refugees. And so absolutely there could be response. It would be a great way to sort of bridge that a little and have that learning go back and forth. I think for the disposal, waste management, and laundering content, a lot of it is relevant to both types of contexts, and it would be great to see bridges to share those lessons. And then just the last final thing was around the issue, and I sort of mentioned this already, but of when you are promoting reusables or disposables, always understanding the local context. If there is while reusables may make sense, given there isn't a good system for disposal, or they can't drop them in latrines, or they, for whatever reason, if there are major water shortages or almost no privacy, because women and girls will tuck their used cloth or reusable into all sorts of places that may not be that clean, really thinking through the context and what will actually be viable, and not giving them solutions that won't actually work where they're living. But just, I would close by saying we would love more examples of good practices around disposal, waste management, learning. And as Maggie said during our session, more evaluation of what's happening and sort of scaling of it so that we can continue to learn from each other going forward.
Great. Thank you so much, Marnie. I'll do a quick wrap up from our session on MHM in the workplace. I think we just have about 1 minute before we'll all be kicked out of the session. So apologies, everyone, for the short time we've had today, but it was a fascinating discussion we had with WaterAid and the Wash Pals project with USAID, and bringing up really the unique considerations for working women in the workplace and drawing on those specific social norms that are unique to the workplace setting. For example, we heard about just how knowledge on the menstrual cycle alone can help inform practices that lead to issues of confidence in the workplace and contribute to earnings. What is the social norm around, for example, we heard from Kenya, this culture of suffering that women have to forbear and persevere, and how does that affect then their experience as workers? One of the important considerations for workplace MHM is really ensuring understanding among the companies themselves and among the workplaces and leadership. And we actually had a Menti poll at the beginning of our session that tried to pull from those in the session about some of their limitations and in workplace MHM from among our participants. And that was also something that came up even among us as participants, that what we're finding in these case studies that we had presented in the breakout session from WaterAid, the case study of Bangladesh and their work there, a really interesting 3-year study looking at 3 different factory settings, 20,000 workers, 40% of those being female, to Nepal, looking at 2 workplace settings there. We heard specifically about one and the unique findings of formative assessment activities there, to Kenya, also working in 2 companies. But how do we draw from the experience of women and menstruators in those workplace settings to really try to pull that thread across to how does that contribute to increased earnings, workplace satisfaction for women, but also to the greater, not greater necessarily, but equal goal of what is the business case for improving MHM in the workplace? And can we actually draw that linkage? What wasn't actually shared, as well as we're also doing a cost benefit analysis there in the Wash Pals effort. So how can we actually draw on the learning? So some other things from the WaterAid presentation, some things that are steps towards empowering a female workforce is, again, the knowledge and practice related to both use of materials, but also safe disposal, and how understanding the do's and don'ts of building confidence among female workers. So there's a lot of unique elements that working women face. And so how can we actually improve their worker experience? So we didn't have a lot of time to wrap up with questions and discussion like we had hoped. But I want to encourage us all to continue the discussion offline. And so I think we have a slide next about contact details, if I'm not mistaken. And that way you can reach all of us. If not, you can go on the website and find all of our contact details for continuing the conversation afterwards. This is a really important new space for all of us. It's new in the sense of all the learnings that we're getting in the recent research that's coming out. So thank you everyone for joining. I think I'll hand it back to Aditi and Marnie, who were the facilitators of the session overall. Here's our contacts, great. So please do stay in touch with us to learn more information, and don't hesitate to reach out. We'd love to learn from you too and what work you're doing in this context and in MHM at large. So thanks everyone.
Great.
Thank you. And there was just one chat question I couldn't respond to, but if you go to our website, the request for all of our emergencies content, it's all listed. If you go to the GATE website and MHM Menstruation Emergencies, you can find the toolkit, the compendium, and soon, if not there yet, the Ebola and MHM guide. So thanks for that great question, Tracy.
Great. Thank you all very much from our side. I've put my contact information there. And I'm happy to connect you to any of the marvelous folks that presented during our session today. So please do not hesitate to get in touch. And thank you all so much for joining and for coming back to the main room. Have a wonderful day, afternoon, evening.